Hello, everyone. My name is Georgia Voller, and I am a Bachelor of Nursing student at Western Sydney University. I have my ID card here, as you can see the number 2213845 6. And for this presentation, I'm going to be discussing with you all the importance of culturally safe healthcare for children and adolescents. Before we begin, this presentation includes a definition of cultural safety and interprofessional collaboration, what it is, what it involves. Then I will be reviewing a case study, and I will introduce you to 5-year-old Duran and how his situation and circumstance applies to this topic. Then I will be outlining the potential barriers in implementing culturally safe care. Then I will be reviewing other members of the multidisciplinary team and how they can work together to provide culturally safe care. And then I will be finishing with an overall summary. To begin, we must have a thorough understanding of what cultural safety is, as it can often be confused with other various terms such as cultural awareness. Cultural safety refers to the practice of fostering an atmosphere that allows for individuals to feel comfortable and respected within their cultural identity. It requires a proactive effort to comprehend, respect, and validate the individual's cultural background, thereby promoting inclusivity and equity. Nurses and midwives work in various healthcare settings and locations, which expose them to a very diverse range of cultures and backgrounds. And given their own cultural background, they will view care through their own cultural lens, which may not align with the perspectives of all individuals on health and well-being. There are varying understandings of cultural care, what it looks like, and how to best achieve it, which is why it is so important that we all have a strong understanding of cultural safety. Equally as important as cultural safety is interprofessional collaboration, which refers to effective collaboration amongst professionals and even organizations, which is a requirement to meet the health needs of individuals. Examples of professionals that often collaborate within the healthcare setting include nurses, doctors, dietitians, social workers, occupational therapists, psychologists, private GPs, and especially when discussing culture, examples can include interpreters, Aboriginal liaison officers, chaplains, or any other cultural representatives within the healthcare sector. It is important to recognise that health and well-being are multidimensional, and healthcare systems that recognise and value professionals' experience and areas of expertise and place them into practice are proven to accelerate positive health outcomes. For everyone to gain a clearer understanding of these concepts and how to put them into practice, I'm going to introduce you to Duran, who is a 5-year-old Aboriginal boy from a remote Northern Territory community who was admitted to a metropolitan hospital with an acute exacerbation of asthma. He presented with severe wheezing, shortness of breath, and oxygen desaturation. His asthma is usually well managed by his parents at home in his community, but seasonal variations can induce unusually severe asthma attacks with him from time to time. His mother accompanied him to the hospital and speaks limited English and primarily communicates in Yolngu Matha, which is her first language. His father is an elder of the community and a leader of the local Aboriginal Land Council and had to remain behind on country. Duran and his family rarely visit metropolitan areas and they find the experience disorientating and uncomfortable. There are no other people from their community in the hospital, which makes Duran and his mother feel isolated and out of place. But how does cultural safety affect Duran's health while in hospital? After reviewing Duran's story, the main risk I identified for impaired care is that Duran and his mother feel uncomfortable in their environment, and English is not their first language. This could cause a distrust between Duran and health staff, non-compliance with care, and the risk of them deciding to discharge early against medical advice to go back to country. Establishing a comfortable cultural atmosphere and safety creates trust between Duran and his family. This trust improves the chances that Duran will be accepting of treatment, continue his treatment, follow up his care plan while out of hospital, attend any follow-up appointments, and increase the likelihood of Duran and his family seeking help in the future. Creating a safe environment can be completed in a variety of ways. For example, organising interpreters who communicate in their first language, involving an Aboriginal liaison officer to discuss with the family ways they can integrate their culture into their care, i.e., an elder, or potentially discussing transferring Duran to a hospital that is closer to their land, or discharging into care of an Aboriginal health service to manage his condition, bringing their homeland to them. Furthermore, involving representation from their culture who are also involved within the healthcare system creates a trust and a therapeutic relationship. And overall, these measures promote increased positive health outcomes for Duran, and when put into practice on a national scale, result in closure of the gap between health outcomes between Indigenous and non. Unfortunately, however, cultural safety is not always achievable due to certain factors. Examples include financial strain due to insufficient funding for our hospital systems. Healthcare sectors must cut back on resources such as training for staff regarding culture, allied health resources, health centres specific to cultures, i.e. the Illawarra Aboriginal Medical Service, which is located where I'm from in Wollongong, and funding into organisations to support culture, such as the National Aboriginal Community Controlled Health Organisation. Another barrier is geographical location. This factor is particularly prevalent in Duran's circumstance. He lives in the remote Northern Territory where there is significant lack of resources specific to Aboriginal and Torres Strait Islanders available. And referring to my first factor, without adequate funding, we are unable to create these resources. If Duran required further extensive treatment, he may have to travel to a significant distance to a more suburban area. However, his family may not be able to or comfortable being that far away from country and their family for long periods. And finally, due to insufficient access to cultural training, healthcare workers may inadvertently bring their own cultural bias and lack of understanding and beliefs from their upbringing into their practice, which can deter Duran and his family and other cultures from accessing health due to fear of judgment. A perfect example of when these barriers and their impact is during coronavirus. The world was in lockdown, everyone was confined to their homes, and we were unable to travel. So we had a lack of resources and finances due to the majority of the population being unable to work, and all of the money from the government was being put towards treating the surge of COVID-19 patients, vaccines, and funding families who had lost their income. And there was a significant amount of misinformation regarding this new disease we had never encountered before, and the vaccine, which caused mass hysteria and distrust in our health system. During this time, the population's previous medical conditions pre-COVID were exacerbated, and our physical and mental health deteriorated drastically. In this hospital setting, nurses need to collaborate with our cultural representatives to achieve the most positive health results and outcomes for our patients. Examples that would be useful and effective in Duran's case, since his mother speaks Yolngu Matha as her first language, are interpreters who are available 24/7 within our health system. Their role is to assist in communication between health practitioners, patients, families, and carers who do not speak English fluently or who are deaf. When they use public health services, which ensures accessible, safe, and high quality care. Also, access to Aboriginal liaison officers is available. ALO provides social, emotional, and cultural support to Aboriginal and Torres Strait Islander patients admitted to hospitals across Australia. The ALO can accompany patients when talking to health professionals to understand medical procedures and link them with appropriate services and support programs. And finally, social workers are very effective in cultural settings. Their role is to identify, educate, and provide therapeutic interventions and consultation on presenting psychosocial and emotional risks that impact well-being. These interventions significantly influence the patient's client's care plan to be more reflective of their needs. So to summarize this presentation, cultural safety is essential in providing effective care and promotes better results in treatment for all individuals. For cultural safety to be achieved, all members of the health service need to receive training and education regarding it and must operate with the understanding that everyone's has important cultural needs, must be addressed, and no one's belief or culture is above anyone else's. However, in order to achieve it, we must collaborate with our other professionals with specialty experience within this subject in order to create effective results for everyone. For example, incorporating an interpreter for Duran and his mother will ensure they are understanding of the treatment and can provide informed consent or decline. Social work can assist with the distance between the hospital and their land and find resources for them to use closer to home. And the ALO can advocate for their cultural needs and customs being incorporated in hospital. Thank you everyone for listening.